Hello, everybody. My name is Kelly Kaczynski, and I'm a urology advanced nurse practitioner from the West Midlands. Great that you can join us and listen to our discussion today. But we are actually joined by Clem, who is a patient who has very kindly offered to share his experience of having hormone injection therapy. I'm just going to start off by asking Clem to introduce himself. So, do you want to just give us kind of your name, your age, a bit of background about yourself, Clem?
Hi, Kelly. Thank you very much. As you said, my name is Clem. I'm 70 now. I've got two grown-up children. I'm married, and three grandchildren. I'm living in Hampshire, and I'm virtually retired now. So yeah, that's basically me.
Oh, that sounds wonderful. So, if I can just ask, what were your first thoughts when the consultant mentioned to you that you needed to have hormone therapy injections?
Well, I was first diagnosed in July 2017, and of course, it's a shock to you to know that you've got prostate cancer. And at the meeting, I was offered the various treatments, hormone therapy being one of them, and then I would have chemotherapy and radiotherapy. So the hormone therapy was suggested that everybody would have it if you've got prostate cancer. So I just accepted that. There was no question whether I would make a decision. I just said, yes, okay. Um, when they said it was by injection, well, that was a slightly different thing because generally I don't like injections. Um, but it happened that there was an option to have it every 3 months, which I was quite pleased to know that it wasn't, weekly or even monthly. So it sort of eased my mind a bit. Um, then I wanted to know more about, why was hormone therapy a treatment? Of course, they went through all the different benefits, the side effects, and some of them weren't very nice. And I sort of thought, well, I wonder if the side effects were going to go away after my body got used to the hormone therapy, the hormones, the change in hormones. And so that was one of my concerns, thinking, does it last all the time, or will my body sort of adapt?
Were you given any kind of written information to take away? You said you were given kind of options, and then you just said, yeah, okay, I'll have it.
Yeah.
And it can be quite scary when you discussing and thinking about having new treatments. And I think sometimes people may need to reflect upon that. So it's always useful. So I just wondered if you had any kind of written information given to you.
Yeah, so I had quite a lot of information because right at the start of my treatment, I was asked to go on a trial. And the trial was actually to do with different ways of how the treatment would be given. So hormone therapy, with just hormone therapy on its own, hormone therapy as a patch, hormone therapy with metformin, which is a drug is normally used for diabetes, and which caused all sorts of complications further on because I was on these the link that I was on was to have hormone therapy with injection and metformin as well as part of the trial. So the information was there was a lot of information because I was under a trial team, which fed me with all sorts of information, and hormone therapy was very much one of the things that they were looking at the time.
So, as well as the trial team, did you have any other healthcare professionals who were kind of helping you through that journey?
Mainly my review was done with, I was sort of handed over to the trial team. So, my nursing specialist was the trial sort of coordinator as well
Okay.
for my team and the oncology as well. So, I was sort of a dual purpose when I went. Um, and also the hormone injections were given, as I said, 3 monthly. But my
Mhm.
wife, I didn't mention, my wife was a nurse. So when the first injection was given at the doctor's surgery, and we thought, I don't really want to be going to the doctors every 3 months to
Yeah.
have it. And I asked whether my wife, could my wife give the injections? And the
Yeah.
sort of, well, the nurse said, well, maybe we'll have to ask the doctor. And
Yeah.
then the doctor said, well, I can't see any reason why you can't, because, your wife was a nurse. And so they agreed to that, which meant I could have it at home.
So when you were having the injections,
Hmm.
kind of which bit in the body did the injections go into? Where did you have them?
I was just going to say about that actually. So that was very good timing. Yeah, when I was having these injections, it was odd because it was in my stomach, just, my tummy area. But they would rotate left one time, next time it would be on the right side. But every time I had it on the left side, it was really, really painful. I mean, really painful. Then I have it on the right side the following time, and it was like just a normal injection. So that was a bit puzzling, but
Yeah.
yeah, I can't understand it. My wife didn't understand it because it was like, just the other side of my tummy.
Yeah, and sometimes, these things happen. We can't always find an answer for them, but
No,
obviously, by rotating it around in the different sites, it does
yeah,
help to kind of limit those side effects of it
yeah,
constantly feeling sore.
yeah, yeah. It did
Okay.
really weird.
So I know that you were part of the clinical trial, but routinely, as part of your prostate cancer management
Mm.
and as part of being on the hormone injections, were you having any other regular tests alongside those injections?
Yes, I was having a PSA blood test every 3 months. So I'd go up, have the test done, and I'd continue to have the hormone therapy anyway, but they just wanted to see how the PSA was coming down, or how it was reacting to the hormones. Thankfully, it did come down quite a bit. So I continued, and I continued to have the hormone therapy for 5 years, and
Okay.
that was partly to do with the trial as well.
Yeah, I mean, some people may have it for 3 months, but anything
Mm.
up to 5 years. So
Mm.
it does vary from patient to patient, depending on their level of prostate cancer, really.
Yes, yes, okay.
So, other than the soreness that you had at the injection site, were there any other side effects which you feel could be
Mm.
attributed to those injections?
Oh, very much, yes. There's a long list of them actually, and some of the very obvious ones about getting tired and feeling, just emotional. I became quite emotional. I'm usually a
Mm.
very lively, bubbly sort of person, but I would find that things would upset me, and I'd be close to tears.
Yeah.
That wasn't very nice at all. So even just going out to do the gardening, I just felt, oh no, I don't want to do this.
Mm.
And somebody said something to me, I might think, oh, what are they on about? And just getting
Yeah.
a bit moody. Other than you're, because of the testosterone, the loss of the testosterone. So, the male function sort of disappears completely. And I think I just accepted that, because I knew that's one of the things that would happen. It wasn't just, maybe it was generally gonna happen.
Mm.
So I just accepted it really.
Was there anything which kind of helped you through that at all?
Well, the tiredness, I just try to, get up and be more active. In fact, one of the things that I did do was, we live in a house which has got upstairs and downstairs bathrooms. So if I needed to go to the toilet, I would go upstairs. So I'd make
Yeah.
an effort to climb the stairs to go upstairs, and later on it did start to get a bit, more tiring.
Mm.
But I kept doing that. And other things like, I was recommended to take evening primrose oil,
Mm.
little capsules. So I took those. Not sure if they did much good, but I kept taking them, just anything to make it go away. I had a lot of hot flushes, I had to stop drinking alcohol. I'm not 100% sure it was the hormone therapy, but I'd like to say it was, because after I stopped the hormone therapy, my body was normal again. I could drink again. Yeah, it made me ill having to. I had half a glass of wine once. We were having a meal with some friends, and it really made me. I had to go and sit down on the settee. I was feeling
Mm.
so shaky and ill, and just yeah, not very nice. So yeah, I had quite a few side effects. Some of them just coped with as part of the treatment, and others I tried to, like being active, um, try not to take things too emotionally, not to be too sensitive. And when you feel that you were getting that way, I just sort of, so yeah, stop.
I think, what you've just said about the alcohol is something that a patient's never said to me before.
Ah,
So, that may be something I, kind of listen out
yeah,
for or ask patients about in the future.
yes,
So,
yeah,
thank you for sharing that, as I
okay,
say. Um, you said that your hormone injections, they did affect you emotionally.
yes,
And you kind of just got on with that, but that must have been a very difficult time for you and your family. So
yes.
your wife, from what you said, she was giving you your injections, and she's obviously very supportive, but do you think that had an effect on her as well?
I think, yeah, possibly because I was reacting differently to certain
Mm.
situations. Where normally I would be like, oh, don't worry about it, I
Mm.
would be more I think the feminine, the feminine side of me came out more. And I was more understanding with my wife, I think,
Yeah.
of things that, generally I would not have noticed. I would sort of
Yeah.
just let it go by. And so I think she understood that as well. And as I said, she was very supportive. And, she still
Mm.
is supportive in everything
Mm.
I do. Um, so yeah, it did affect us
Mm.
both, basically.
Yeah, I mean, with family and friends, I always say to them, these changes can happen and people can become more emotional, because I
Yes,
think it's really important people do have that support and
yes,
that family and friends understand why that's happening to
yes,
you.
yes, it
Yeah.
is. Yes.
Okay, so if you were feeling a little bit tired and kind of emotional from these, did you have to change your lifestyle in any way, particularly?
Um, I think other than the drinking, which I don't drink, I didn't drink a lot, and I still don't
Mhm.
drink a lot. Um, Going out, we still did that, but I was aware that I had to, if I'm sitting in a restaurant and there's a group of four of us, four or six of us, I would get hot flushes. So I
Mm.
would try to wear things. I wouldn't wear a thick jumper, for instance. I'd wear something that I could whip off if I had a jacket off, I could take a jacket, I could take it off quickly and, get cooled down basically. And another thing is I had a fan that would take around with me as well, which looked a bit feminine, but if you've got sweat pouring down you and you just sort of do this and explain. I did explain to my friends, they all knew, and I just said, yeah, another hot flash coming, hang on. And sometimes
Yeah.
just make a joke of it. Um, so I try to keep everything normal. I was off work because I was having treatment for my chemotherapy as well to start with as well. That made me quite ill after the third session. So I stopped working and I was off for quite a while. And then after the radiotherapy, I went back to work and, tried to be back to normal. But as I said, the hormone therapy went on for quite a while and the hot flashes did not leave, and nor did the other symptoms. So if anybody was wondering, does your body get used to it? In my case, it did not. It just kept on going and going.
But since you've now discontinued that treatment, have
Yeah.
things got better?
Yes, yes,
Yeah.
definitely. After a few months, I noticed the hot flushes were going and being active again, physically. Emotionally, I was getting back to normal, so I think it took between 4, 5, 6 months maybe before I got back
Mm.
to feeling the way I was before. Yeah.
But you do feel, how you did before.
Yes, I do now. Yeah.
Yeah.
Very
And that's
much.
really good to hear that, these side effects and symptoms don't last forever,
No.
and they're kind of, you can look forward to the future
Yes, definitely.
without them.
Yes.
Is there anything else that you'd like to say about your hormonal therapy? Any tips, anything for other people who may be, embarking on their treatment quite shortly?
Yeah, I think the being positive, trying to stay active, and you know, just I think face up to the fact that there are certain things that's going to change in your life and you can't control them. And at the end of it, there is a light at the end of the tunnel, basically. It will get better. And the hormone therapy does work. Well, it works in majority of cases, I would say. And just sort of try to accept those issues, and not everybody will have the same symptoms. The side effects don't happen to everybody. Some people get more hot flushes and less hot flushes, and there are other things like acupuncture, as it was recommended to me. I didn't actually have them, but there are other things that could help with the side effects, and to ask questions as well when you go for your reviews. Don't be afraid to say, well, look, these hot flushes are really, really causing a problem.
Yeah.
What can I do? Evening primrose really works for some people. Um, yeah, and just stay positive, basically. It's my method.
Absolutely. Positivity does wonders.
Yes, yes,
Well, thank you for sharing your experience today, Clem. I'm sure there'll be lots of other men out there just like you who are, quite fearful about what's going to happen. And I'm
yeah.
sure that, what's happened to you will help them see, the journey that may be coming towards themselves, and that
Mm.
at the end of it, they do get back to being their normal
Get
selves.
back to, yes, definitely, very much,
Yeah.
yes. Okay.
Okay. So
Thank you
thank
very
you very
much.
much.
Thank you. Bye.
Bye-bye.
Bye.